from interest costs, which are at $1 trillion a year now, the primary driver of our $38 trillion national debt is healthcare spending, the single largest contributor to current and future deficits. Federal healthcare spending grew from roughly $19 billion in 1975 to $1.8 trillion in 2025, nearly a 100-fold increase in just 50 years. Without meaningful reform, this trajectory puts us on the path toward a serious fiscal crisis, which is why today's hearing really matters, in my opinion. Democrats are pushing to revive the so-called temporary COVID-era ACA subsidies, which taxpayer-funded benefits to millions of higher-income Americans. It expanded that, who had never previously qualified. No Republican here supported the ACA or these Biden-era expansions, yet Democrats want to make this costly emergency policy permanent. Subsidies to big insurance companies do not lower health care costs. They simply hide them. Taxpayer dollars mask rising premiums, distort markets, and fail to address affordability. Despite more than $130 billion in subsidies, Americans still face $5,000 deductibles, $21,000 out-of-pocket caps, and denial rates of near 20% by insurance companies. In fact, since 2014, Obamacare premiums have risen nearly twice as fast as employer-sponsored plans. Think about that. Twice as fast as employer-sponsored plans. Why? I believe that insurance companies must think that if the government is going to pay for it, then why not charge more? Apparently, that is the mentality of the big insurance companies, and they're able to get away with it, and it has to stop. While Democrats are focusing on subsidizing coverage for a narrow segment of the population, 7%, Republicans are advancing solutions that help all Americans. We passed the One Big Beautiful Bill to root out waste, fraud, and abuse in the Medicaid and the exchanges to ensure that only eligible citizens receive benefits. We also passed the Lower Healthcare Premiums for All Act, which truly puts patients first. The bill lowers premiums, expands access to affordable quality care, increases choice and flexibility, and improves transparency across the healthcare system. It lowers healthcare costs for all Americans, not just a select few. The nonpartisan CBO found this bill would lower premiums by nearly 12%, not increase them, thereby reducing the deficit, yet not a single Democrat supported the bill. To my witnesses, thank you for being here, all of you. To Dr. Ippolito, healthcare accounts for roughly a fifth of our national GDP and a third of federal spending. What are the ramifications for our economy, our federal budget, and our federal debt if healthcare spending continues to grow, and what should Congress prioritize to avoid these outcomes?
Yeah, I mean, so the effects are broad. I'll start with some fairly direct ones. If costs continue to grow at accelerated rates, we're not going to be able to deliver what we are currently promising people, let alone any ideas that you all have about future ways to expand benefits or expand coverage. And so as a baseline, we need to get the budget in order before we can start thinking about any additional new policies. So I think that's a very important point to keep in mind. Secondly, I think in terms of general approaches, one thing that you touched on that I think is central to all of this is that if the federal government provides open-ended subsidies, in other words, subsidies that simply increase as healthcare costs increase, costs are going to go up. We see it in the Affordable Care Act, where a huge share of enrollees are entirely shielded from premiums. We see it in the employer-sponsored market. It does not matter how expensive that plan gets. The federal government continues to subsidize it. It happens in Medicaid. It does not matter how much the state spends. The federal government dutifully sends its check to the state, over half of the cost. And so I think in terms of central conceptual approaches, that's one area I'd prioritize.
Okay, thank you. Mr. White, question for you, sir. Among many issues, individual coverage exchange plans created by the Affordable Care Act face a significant problem. Over 1/3 of all exchange enrollees do not use their benefits at all. None. For these zero-claim enrollees, health coverages do not translate into health care. Yet insurance companies reap the benefits, collecting billions in taxpayer funds to cover individuals who incur no costs to the insurance companies. So it's pure profit for the insurance companies. What is the fiscal impact of subsidizing these zero-claim enrollees, and what policies might reduce non-utilization while improving the efficiency of federal spending? And how many of them do you think are actually fraudulent policies?
Well, to start out, 35% of enrollees had 0 claims throughout the entire last year of enrollment. That's twice as much as the employer markets, like we'll have typical people without claims. So it's double what we typically see. The check for that enrollee automatically is paid from the Treasury to the insurance company.
Right.
Even though they're incurring no costs. And it's estimated that a large portion of that 35% are fraudulent enrollees because they got through the gate, there was no control. They were signed up by an unscrupulous broker or directly by an insurance company. And so having some kind of control, the best one is just charge a minimum premium, whether it's $5 a month or the state's minimum wage, 1 hour of a state's minimum wage, something like that. Then tells the person, oh, wait a minute, I'm actually enrolled in this plan. I don't want to be in this plan, et cetera, et cetera.
Gentleman's
So
time's
it's
expired.
tens of billions of dollars.
Thank you, and I yield back.
I thank the gentleman from